Medicare planning can be quite complex. If you're not careful, you can cost yourself thousands and thousands of dollars over your lifetime. In today's video, we're going to tell you everything you need to know to make your Medicare planning easy.
And if you stay until the end, we're going to give you all the details of the things that Medicare does not cover.
Let's jump in. So Medicare is medical insurance. It's a federally sponsored plan, and you're eligible for it when you turn 65. And Medicare has two parts to it. There's Part A, which covers your hospital visits. And then there's Part B, which is your doctor's visits and your outpatient care.
And so what we're looking at here is what all things Medicare Part A covers. But to break it down in a more simple form, just think of Medicare Part A, and the A is where are you at? So the hospital. And this usually comes to you as a benefit that you don't pay for as long as you've worked for 10 years.
Right. For Part B, that's going to cover your doctor's visits, your annual checkup, x-rays, lab assessments, those sorts of things. And you do have to pay for Part B.
Yeah, so the premiums, they start off for you for Part B at $174.70 for 2024. So this does change usually every year, but for this year, $174.70. And if you make too much money in retirement, then these premiums could have additional cost to them with the IRMAA surcharges. So be aware with what your income is looking like at age 63, because there's a 2-year look back from your starting age of 65. And then also be aware of those required minimum distributions in the future. Those could throw you up into a higher earning year and affect your Medicare premiums.
That's right. And then as far as how you pay for the premium, if you're collecting your Social Security benefit, your Medicare premium will be withheld from your Social Security benefit. However, if you're delaying your Social Security benefit, you've not turned it on yet, then your Medicare premium will be an out-of-pocket expense until you go ahead and turn on your Social Security. So we've talked about Medicare Part A and B, and oftentimes it's not enough. You're going to need more coverage. So where can you get more coverage? And that's where there's two options that come into play. One is going with a Medicare Advantage plan, and the other is going with a Medigap or Medicare Supplement plan. We're going to break down the differences right here. So Medicare Advantage is also known as Part C.
So A, B, and C.
Right. It's like the alphabet soup here with Medicare. And so with Part C, with an Advantage plan, you actually leave original Medicare. You're still part of Medicare, but it's basically an alternative to the original Medicare here. That's one of the differences. If you are a person that you're looking for lower monthly cost and you're not too particular or picky on your doctors and your coverage, Medicare Advantage is a good way to get all the coverage you need at a more reasonable cost. Some benefits of Medicare Advantage are the following. You can't be denied coverage based on current financial health status. Also, there's an annual limit of your out-of-pocket costs for covered services. So those are benefits and reasons why people like Medicare Advantage. Typically, the premiums are fairly reasonable.
One of the negatives here, though, is that you have to use the people in the network, so doctors, the pharmacists within the network.
Right.
So it could be good if you're planning to retire and stay put.
Right. Versus Medigap insurance, this works with your original Medicare Part A and B, and then most people will add in a Part D plan, which we'll talk about in just a minute. And so if you are particular about the physicians and doctors that you want to work with and the hospitals that you want to go to, you get a little bit more control and flexibility with Medigap. Also, Medigap could be more appropriate if you like to travel, if you're living in multiple states. Medigap might offer you more coverage. And the way that we look at it is it could be a little bit more expensive on your monthly payment, but in the end, there may be a savings if you're utilizing your coverage. So it really highlights the fact that you have to understand, you have to have a plan going into this thing. You have to know your lifestyle and then really make the decision on, is Advantage better for you or is Medigap?
And so here's a good side-by-side comparison of the Medigap versus the Medicare Advantage plans. And like we talked about, if you're flexible on the physicians that you're working with, it may be more beneficial for your Advantage plan. If you're looking to travel more in retirement and not necessarily staying at home, then the Medigap policy may be better for you. The cost, if you're looking for a lower cost plan, then the Advantage plan could be better for you. But if you're looking at utilizing the plan more often, then that Medigap policy may be better for you. The Advantage is kind of like an all-in-one plan, whereas the convenience or has more convenience in the all-in-one. But if you use the supplemental plan, then you have to start getting all the different pieces, A, B, C, and A and B, and usually people add a D to that.
Right. So that's the perfect segue. Let's talk about Medicare Part D. So Medicare Part D is your prescription drug plan.
And I would recommend signing up for Part D because if you don't sign up right when you turn on your Medicare, there's an ongoing penalty that never goes away.
Right. And so the base cost is $40 per month. Could be higher if you're subjected to IRMA. But as Matt pointed out, if you fail to sign up for Part D right away, then the increase in cost will be applied to you for the rest of your life if you go back and sign up later. All right, so putting it all together, and as you can see, there's a lot of moving parts to Medicare. We're going to help you start to simplify it and understand. So you got your choice of sticking with original Medicare, Part A and B, and then going with a Medigap or Medicare supplement policy, and then tacking on a Part D or a prescription drug plan. That's what you see here in option 1. And then option 2 is leaving original Medicare and going with a Medicare Advantage plan, which oftentimes will have that prescription drug, the Part D plan, included in an Advantage plan.
So if we look at original Medicare, so Parts A and B, the first way that you could set it up is just having Part A and Part B alone, but we talked about the pros and cons of adding that Part D or the prescription drug policy to your plan. So you just have A, B plus your Part D. If you want to fill in some of those holes within your plan, then you may want to add a Medigap policy. So again, you'd have your Part A, your Part B, plus that Medigap policy. And then if you want the Cadillac of plans, then you may want the A plus B, having that Part D, and having a Medigap policy on top of that to fill those holes.
And that's pretty typical of what we see people do, is they will have all 4 components, or they will choose to go with the Medicare Advantage plan, which again is going to offer you the same type of coverage. So either way, just knowing what's most appropriate for you, having a plan and a strategy, and understanding how Medicare works.
Okay, so with Medicare, there are enrollment periods. When you're originally signing up for Medicare, it's at your age 65. But really, you have the 3 months prior to you turning 65 and then the 3 months after. So total, you have 7 months to sign up for Medicare. We would recommend signing up for it earlier than later because you don't want to miss that sign up window, because then again, there's penalties and fees that go along with it. So what if you plan on working past 65? Do you need to sign up for Medicare?
That's a great question. If you're working past the age of 65 and your employer has a group medical plan and there's at least 20 employees on the coverage, then you're not required to sign up for Medicare so long as you're covered by that group plan. But once you retire or sever service from your employer, you're going to need to go down and sign up for Medicare within the special window. And you're also going to need to prove that you had medical insurance for all the months and years after the age of 65, so that way the penalty is not assessed to you. All right, so in general, we're going to talk about what Medicare costs, and we've been talking a little bit about it throughout, but the Part A is free.
Mm-hmm. Well, Part A typically free, so you need to have had to work for 10 years. And why I say that is because out of payroll tax is where you're paying for Medicare along the way. And that's coming out of your paycheck if you're an employee of 1.45%. And then if your employer is matching the 1.45% there as well, or you're paying both if you're self-employed.
Right. And then there is a cost for Part B.
So Part B, $174.70 a month in 2024, and that can come out of your pocket or usually comes out of Social Security. What we're finding is that people who are delaying their Social Security benefits are having to come out of pocket to pay Part B.
Right. And then the IRMA surcharge that Matt talked about earlier on your Part B and Part D, that comes into play if you're married filing jointly with income north of $206,000, now all of a sudden that monthly cost goes up on both Part B and Part D.
So be careful if you're trying to take advantage of Roth conversion strategies, because you may be maxing out or wanting to max out the 24% tax bracket, but it doesn't always line up exactly with the IRMA surcharges, and you may be bumping up into those penalties without even realizing it.
That's right. That's right. And then for a Medigap or Medicare Advantage plan, you can be looking at anywhere between $100 to $200 a month extra. And then your Part D coverage is about $40 a month in addition, plus whatever IRMA may tack onto that. So all in, you could be looking at paying somewhere between $400 to $500 for Medicare. But you get great coverage, and that's significantly less than what you'd be paying in the private market or in one of the exchanges.
Right. So if you're planning to retire before 65 and you have that private insurance, you may see a reduction in expenses when you flip over to Medicare.
And now for the moment that you've all been waiting for. What does Medicare not cover?
Well, I thought it covers everything, Brad. You said you gave us so many details in there, but the number one thing that stands out is long-term care. Most people think that Medicare covers some form of long-term care, but it actually doesn't. So I would be prepared with a long-term care policy or self-insure and make sure that you're covered if you're one of the 70% of Americans that this is going to happen to.
Right.
And then if you're an avid traveler, just know that Medicare isn't going to cover anything while you're overseas, but there are insurances out there that you can fill in that gap as well. And then believe it or not, dental, vision, hearing, glasses, contacts, these things aren't covered with Medicare either. So just make sure that your plan is prepared to cover these costs if you have them. And so not all of the out-of-pocket costs are covered by Medicare, and along with the prescription drugs that we talked about, Part D. So make sure to get that in place too.
We know that Medicare planning can be complex. There's a whole alphabet soup of things to navigate through. We hope you enjoyed the video, and we hope this was helpful. And if you need some assistance in navigating your Medicare decision planning, please feel free to reach out to our team. We would be glad to assist you and help you make great decisions when it comes to your own Medicare planning.
And be sure to like and subscribe. And then if you click below, we've got a free Medicare guide for your use.
See you on the next one.